Hi everyone. Today we are going to talk about osteoporosis. What is osteoporosis? Who gets it? What are the symptoms? How do we diagnose it and how do we treat it? So if any of this affects you or your family members or friends, make sure you stick around to the very end of this video so you do and miss any of this useful information. Osteoporosis is a disease where there is a decrease in bone mass and density, resulting in fragile bones that are more likely to fracture. It is called a silent disease because often there are no symptoms until a fracture occurs. That's why it's important to get regular bone density tests, especially if you are at risk for osteoporosis. Anyone can develop osteoporosis, but the risk increases as a person ages, especially after menopause in women. During our peak years, our bones are constantly being broken down and rebuilt. But when this process is not properly balanced, bone loss occurs faster than bone formation. This results in weaker bones and an increased risk of fractures. There are two types of osteoporosis, type 1 and type 2. Type 1, which accounts for approximately 80% of cases, primarily affects women after menopause due to rapid bone loss during this stage of life. In contrast, type 2 is more common in men and postmenopausal women, but it's also seen in younger individuals with other conditions such as rheumatoid arthritis, celiac disease, or liver disease. Unlike type 1, the bone loss in type 2 is more gradual and occurs over several years. Several factors can increase one's susceptibility to osteoporosis. Advanced age is a significant factor as the risk of osteoporosis increases with age. Being female also poses a higher risk as women tend to have thinner and less dense bones compared to men. Furthermore, a family history of osteoporosis suggests a genetic predisposition, making it crucial to be proactive about bone health. Additionally, hormonal changes, including menopause in women or low testosterone in men, can contribute to bone loss. Lifestyle habits such as smoking, excessive alcohol consumption, and inadequate calcium and vitamin D intake can accelerate bone loss and increase osteoporosis risk. Certain medical conditions like rheumatoid arthritis, celiac disease, inflammatory bowel disease, and hyperthyroidism can also negatively impact bone health, making it essential to manage these conditions effectively. Medications such as corticosteroids and some anti-seizure medications can interfere with bone metabolism, potentially leading to osteoporosis. Therefore, individuals taking these medications regularly should work closely with their healthcare providers to monitor their bone health. Recognizing the signs and symptoms of osteoporosis is crucial for early intervention and prevention of fractures. However, it's important to note that osteoporosis is often asymptomatic, meaning no noticeable symptoms may be present until a fracture occurs. Therefore, regular bone health screenings and monitoring are essential, particularly for individuals at high risk. Some potential indicators of osteoporosis include bone pain, particularly in the lower back or spine, along with a loss of height over time. A stooped posture or a shift in spinal curvature may also suggest vertebral fractures. Additionally, frequent fractures or a history of previous fractures, even from minor injuries, can be indicative of underlying bone loss. While these signs and symptoms may not be definitive, it's important to consult a healthcare professional for proper diagnosis and management. Diagnosing osteoporosis involves a comprehensive approach that includes a thorough medical history review, physical examination, and various tests to assess bone health and identify contributing factors. The first step typically begins with a discussion of the patient's medical history, including age, gender, family history of osteoporosis, and previous fractures. The healthcare provider will inquire about any conditions or medications that might be contributing to bone loss. A physical examination is also conducted to evaluate general health, assess muscle strength, and check for any signs of skeletal abnormalities or fractures. One of the primary diagnostic tools for osteoporosis is a bone density test, which measures the density and strength of the bones. The most common type of bone density test is a dual energy XOR, absorptiometry or DXA scan, which uses low doses of radiation to estimate the amount of bone mass and the risk of fractures. Another important investigation is a blood test. Blood tests are used to measure various factors that can affect bone health, such as hormone levels, vitamin D levels, and the presence of inflammatory markers. For instance, measuring estrogen levels in postmenopausal women can help determine the cause of their symptoms and guide treatment options. Vitamin D levels are also assessed, as vitamin D deficiency has been linked to osteoporosis and other bone-related conditions. Additionally, blood tests can detect underlying medical conditions that might be contributing to bone loss, such as hyperthyroidism or other hormonal imbalances. By analyzing the results of these blood tests, healthcare providers can gain insights into the patient's overall bone health and identify any additional interventions or treatments that may be necessary. The primary treatment goal for osteoporosis is to reduce the risk of fractures and improve overall bone health. The treatment plan typically includes a combination of medication, lifestyle modifications, and regular monitoring. Medications commonly used to treat osteoporosis include bisphosphonates, which are drugs that help increase bone density and reduce fracture risk. These medications are available in various forms, including oral tablets and intravenous infusions. Other classes of drugs, such as selective estrogen receptor modulators, SERMs, and hormone therapy (HT), may also be considered, particularly for women who have recently gone through menopause. Additionally, bone-forming medications such as teriparatide, a synthetic version of the parathyroid hormone, can stimulate bone formation and improve bone mass. Alongside medication, lifestyle modifications play a crucial role in managing osteoporosis. These include maintaining a balanced diet rich in calcium and vitamin D, engaging in regular weight-bearing exercises, avoiding tobacco and excessive alcohol consumption, and ensuring adequate hydration. Regular monitoring is also essential to assess the effectiveness of treatment, monitor bone density, and make any necessary adjustments to the treatment plan. This may involve periodic bone density tests, blood tests, and follow-ups with the healthcare provider. In addition to the treatment plan recommended by a healthcare professional, certain supplements may be beneficial for individuals with osteoporosis. Calcium is an essential nutrient for maintaining strong bones, and many adults do not meet the recommended daily intake through their diet alone. A daily intake of 1,000 to 1,200 milligrams of elemental calcium is generally recommended for postmenopausal women with osteoporosis. Vitamin D is another crucial nutrient that helps the body absorb calcium and maintain bone health. It's recommended that adults get at least 600 to 800 international units of vitamin D daily. Additionally, vitamin K2 is important for bone health, as it helps activate osteocalcin, a protein essential for bone formation. A daily intake of 90 micrograms is recommended for adults. Magnesium is another mineral that plays a role in bone health by helping regulate calcium metabolism and supporting muscle function. A daily intake of 400 to 420 milligrams is recommended for men and 310 to 320 milligrams for non-pregnant women. Lastly, protein is a vital component of bone tissue. An adequate protein intake is essential for maintaining bone mass and strength. The recommended daily allowance for protein varies based on age and sex, but generally adults should aim for 0.8 grams of protein per kilogram of body weight. Preventing osteoporosis involves adopting a proactive approach to maintaining bone health throughout life. It's crucial to start early and continue these preventive measures throughout adulthood. One of the key strategies is to engage in regular weight-bearing exercise. Weight-bearing exercises are physical activities that require the use of one's bones and muscles against gravity, such as walking, jogging, dancing, or weight training. These exercises help stimulate bone formation and increase bone density, reducing the risk of osteoporosis. Aim for at least 30 minutes of moderate-intensity weight-bearing exercise most days of the week. Maintaining a balanced diet rich in calcium and vitamin D is also essential for preventing osteoporosis. Calcium is vital for building and maintaining strong bones, while vitamin D aids in the absorption of calcium. Ensure your diet includes calcium-rich foods such as dairy products, leafy green vegetables, and fortified foods. Similarly, incorporate vitamin D-rich foods like fatty fish, eggs, and fortified options into your meals. If dietary intake is insufficient, consider taking calcium and vitamin D supplements as recommended by healthcare professionals. Avoiding tobacco and excessive alcohol consumption is crucial for bone health. Tobacco smoke reduces the absorption of essential nutrients like calcium and vitamin D, impairing bone formation. Excessive alcohol intake also interferes with bone metabolism and can lead to bone loss. Therefore, it's advisable to quit smoking and limit alcohol consumption to reduce the risk of osteoporosis. As we age, our bones become weaker and more prone to fractures, making it important to take good care of ourselves. One way we can do this is by using mobility aids such as canes, walkers, and wheelchairs. However, choosing the right mobility aid can be challenging. That is why we created a comprehensive guide to help you make the best choice for your needs. Our guide covers the benefits and drawbacks of each mobility aid, as well as tips for choosing the right one for your situation. We take into account factors such as the severity of your mobility issues, your budget, and your desired level of independence. Whether you're recovering from an injury, managing a chronic condition, or simply looking to improve your mobility, our guide can help you choose the right mobility aid to meet your needs. Don't let mobility issues slow you down. Click the link below to access our free guide and take the next step towards a more independent and fulfilling life.